So, how severe is iron deficient? It is one of the most overlooked yet powerful minerals your body depends on. If you have been feeling drained, foggy, or just not quite yourself lately, this presentation could change everything. Iron plays a vital role in energy, mental clarity, immunity, and even mood. Whether you're a busy professional, a parent, an athlete, or just someone want to feel more alive, this is for you. So grab a pen, stay with me, and let's unlock the power of iron. Iron is far more than a mineral. It is the element that gives your blood its color, your body its power. And in its core, iron is the building block of hemoglobin, the oxygen-carrying protein inside red blood cells. Every time you breathe in, oxygen enters your lungs, but it's iron that grabs that oxygen and escorts it to every cell in your body. Without iron, oxygen can't reach your muscles, brains, or vital organs. But iron's job doesn't stop at oxygen transport. It also helps your brain stay sharp by supporting neurotransmitter synthesis like dopamine and serotonin. Your immune system fights off infection by enabling white blood cells to work effectively. Your hormones stay balanced, especially thyroid hormones, which controls metabolism. Your temperature regulation stays steady. People low in iron often feel cold. Think of iron as the delivery truck for oxygen. No truck, no fuel. No fuel, no energy. That's why when iron is low, people often feel exhausted, weak, short of breath, or mentally foggy, even if everything else looks normal. And while we only need trace amounts, these few milligrams a day make the difference between vibrant health and daily fatigue. Iron also plays a role in mitochondrial function, your cellular batteries. Without iron, those energy factories stall. So whether you are lifting weights, chasing your kids, or solving problems at work, it's iron behind the scenes making that energy happen. In essence, iron is your internal power grid, keeps it optimized, and everything lights up. Iron deficiency is the most widespread nutritional deficiency on the planet. And the tricky part, you can be low in iron for years without realizing it. Symptoms often creep in slowly and are easy to blame on just getting older, stress, or burnout. But here's the truth. When your iron is low, your body can't operate at full power, period. So now let's go deeper into key signs of iron deficiency and what they really mean. Fatigue and weakness. Iron is essential for oxygen delivery and energy production. Without it, your cells are starving for air. That leads to deep fatigue that no amount of coffee can fix. Pale and sallow skin, less hemoglobin equals less red pigment in the blood. People with low iron often look pale, even sickly, especially in the face, inner eyelids, and gums. Low iron affects brain oxygenation and neurotransmitters like dopamine, results slower thinking, forgetfulness, and reduced productivity. Without iron, your blood can't carry enough oxygen. Even climbing stairs can feel like a workout. This is often one of the first red flags. Iron is critical for hair follicle health and nail growth. Deficiency can lead to shedding, thinning, or spoon-shaped nails. Low iron means poor circulation and reduced thyroid hormone production, making you feel cold even in warm rooms. Iron is essential in the brain region that control movement, and deficiency is strongly linked to this uncomfortable urge to move your legs at night. Even low to normal levels iron, still technically within range on a lab test, can cause these symptoms in sensitive individuals. So if you are feeling off and no one can figure out why, it might be time to look deeper at your iron stores, especially ferritin, your iron reserve marker. Low iron doesn't just impact how you feel today, it chips away at your brain function, thyroid performance, immune health, and overall quality of life. So it's one thing to know that iron is essential, but it's another to understand why so many people are deficient, especially when they think they're eating well or getting enough. The truth is, there are 4 major reasons why iron tank run low, and sometimes they overlap. Blood loss is the number 1 cause. Iron lives in your blood, so when you lose blood, you lose iron, period. Women with heavy menstrual periods lose up to 10 times more iron each month than average. GI bleeding from ulcers, polyps, or even chronic NSAIDs used like ibuprofen, Aleve, Advil. Frequent blood donation can lead to iron deficiency. Surgery or trauma. This is often the first thing we look for when iron stores are low. Now, inadequate intake, especially in plant-based diet. You may be eating enough iron-containing food, but not enough absorbable iron. Iron from animal sources, heme iron, is absorbed at about 15 to 35%, while iron from plant sources, non-heme iron, is absorbed at only 2 to 10%. Vegetarians, vegans, and those on restrictive diet like low meat, low calorie, or picky eaters are especially vulnerable. Iron-rich foods include red meat, liver, clams, lentils, pumpkin seeds, tofu, and spinach. But pairing non-heme iron with vitamin C dramatically boosts absorptions. Poor absorption. Even if you eat enough, sometimes it's not what you eat, it's what your body can absorb. Several conditions block or impair iron absorption. Celiac disease damages the small intestine, is where iron is absorbed. Inflammatory bowel diseases like Crohn's or ulcerative colitis. Irritable bowel syndrome like IBS, often accompanied by low-grade malabsorption. Low stomach acid hypochlorhydria, common with aging or long-term acid blockers like PPI. Plus, certain substances in food like calcium, coffee, tea, or high-fiber cereals bind to iron and block absorptions if consumed at the same time. There's sometimes increased needs outpacing the supply. Certain life stages or lifestyles demand more iron than usual, and if intake doesn't keep up, deficiency follows. Who's at risk? Pregnant women need nearly double the daily iron intake to support baby's blood supply. Teenagers, rapid growth equals high demand. Endurance athlete, iron lost through sweat, foot strike hemolysis, and increased turnover. Frequent exercisers or chronic dieters, low intake plus high output equals imbalance. These groups often have subtle symptoms that get dismissed as normal fatigue when iron is actually the missing piece. So if you are tired, cold, foggy, or constantly dragging, don't just look at your diet. Look at where your iron might be leaking, blocked, or burning through. Iron comes in two forms: the heme iron, which is found in animal products, which is absorbed better, 15 to 35%, and non-heme iron, which is found in plant, low absorption, 2 to 20%. Both are important, but knowing the difference helps you build a better diet. When it comes to restoring or maintaining healthy iron levels, your first and most powerful tool is food. So let's break it down, the best sources and how to prep them to get the most out of every bite. Heme iron from animal sources and is the most bioavailable. Top picks includes red meat, especially beef and lamb, liver, nature's multivitamin. Just 1 ounce can pack 5 milligrams of iron. Chicken and turkey, dark meat has more iron than white meat. Seafood, clams, oysters, mussels, sardines. These foods are rich in heme iron, which your body absorbs efficiently, even without help from vitamin C. The non-heme irons are plant-based, which is about 2 to 10% absorptions, and plants contain iron too, but it just needs little help to be absorbed. So iron-rich plant foods include lentil, chickpeas, black beans, tofu, tempeh, spinach, kale, and Swiss chard, quinoa, amaranth, pumpkin seeds, and sesame seeds. Fortified foods include cereal, oatmeal, and plant milk. So always pair with vitamin C source like citrus, bell peppers, tomatoes, or strawberries to boost absorptions up to 4%. Want a simple, non-supplement way to get more iron? Just switch your pan. Cooking in a cast iron skillet, especially with acidic foods like tomatoes or lemon juice, can increase the iron content of the food by up to 16 times, depending on the recipe. Best foods to make in cast iron include tomato-based sauce, soups and stews, stir fries, eggs, and hash with greens. One study found a single serving of spaghetti sauce cooked in cast iron delivered up to 5 milligrams more iron than the same dish cooked in stainless steel. Iron blockers. What to avoid with iron-rich meals? Even the best iron-rich meal can fall flat if it's combined with iron blockers. Avoid these within 1 to 2 hours of high iron meals. Coffee and tea contains tannins that bind iron. Calcium supplements and dairy compete for absorption. High phytate foods like unsoaked bran or raw legumes. Instead, keep your iron meals clean and combine with vitamin C for maximum benefits. You are eating iron-rich foods, but is your body actually absorbing the iron? Here's the thing. Absorption is where many people lose out. Iron is tricky. Some forms are easily absorbed. Others need help. And some everyday foods or drinks can shut the door on absorptions entirely. So let's unlock these smart ways to maximize every bite. Pair non-heme iron with vitamin C. It can increase absorptions by up to 4 to 6 times. Why it works? Vitamin C, the ascorbic acid, converts ferric iron into ferrous iron, which is more readily absorbed in the intestine. Great combos include lentils and bell peppers, tofu stir-fried plus broccoli plus lemon juice, iron-fortified cereal plus orange slices, spinach salad, strawberries, and balsamic vinegar, quinoa bowl plus roasted Brussels sprouts plus lime juice. Even a small dose, as little as 50 milligrams of vitamin C, about half an orange, can have a big effect. So avoid some common iron blockers. Some healthy habits like tea or dairy can tank your iron absorptions. Tannins in tea and coffee can reduce iron absorption by up to 60%. Calcium competes with iron for uptake in the small intestine. Phytates found in whole grains, legumes, and some raw seeds. Polyphenols found in dark chocolates, red wine, and some herbs. Avoid these within 1 to 2 hours before or after your iron-rich meals. Some plant compounds bind to iron, but smart prep can break the bond. Soak legumes, nuts, and grains before cooking. Sprout seeds and grains boosts bioavailability. Ferment foods like sourdough or tempeh. Cook spinach reduces oxalates, which can bind iron. These simple techniques lower phytates and oxalates, making iron more available to your gut. Iron and calcium don't play well together. Don't take calcium supplements or consume high calcium meals with iron-rich food. Milk, yogurt, and cheese reduce iron absorption by 50 to 60%. Take calcium at night if you're working to improve iron levels. Sometimes food isn't enough. Iron supplements can help, but not all forms of iron are created equal. Ferrous sulfates are strong, but can cause GI side effects. Iron bisglycinate, gentle and well absorbed. Always check with your doctor before starting, especially if you have other health problems. Now, testing and monitoring. Ask your doctor about these tests. Ferritin, which measures iron stores, serum iron and TIBC, transferrin saturation, hemoglobin, hematocrit levels. Low ferritin often shows before anemia, so easily testing is key. Too much of a good thing until it's not. While iron is essential for oxygen transport and energy production, excess iron can become toxic, especially when it accumulates over time. This is why iron supplementation should always be guided by lab testing and not guesswork. Who's at risk for iron overload? People with hemochromatosis. It's a genetic inherited condition, causes excessive absorptions. Older adults, especially men, less likely to lose iron through menstruation or other causes. People on long-term iron supplements, especially without monitoring. Patients with repeated blood transfusion, risk of iron accumulation. Heavy alcohol users. Alcohol can damage liver and affect iron storage. Red flag symptoms for iron overload. Symptoms, why it happens. Chronic fatigue, iron deposit disrupts mitochondrial functions. Joint pain, iron accumulates in the joint. Liver dysfunction, iron builds up in liver causing inflammation. Abdominal pain, especially in hemochromatosis. Bronzing of the skin, bronze diabetes. Iron affects skin pigments. Diabetes, pancreas damages from iron. Irregular heart rhythm, cardiac iron overload. These symptoms often appear gradually and are easy to miss. Test before you take. Check ferritin and iron panel. Retest every 3 to 6 months if supplementing. Don't supplement just because you are tired. Avoid iron-containing multivitamins if you already have high ferritin. Hemochromatosis is the most common genetic disorders in Caucasians. 1 in 200 people have it. Many undiagnosed, causes excess iron absorptions from food, may be asymptomatic for years until damage is done. Simple blood tests or genetic screening can confirm it. Get labs before starting iron. Know your ferritin sweet spot between 30 to 100. Avoid stacking iron with other sources unknowingly. Work with a provider if a long-term supplementation. Be aware of symptom overload. Iron is a life-changing when optimized. Start by tuning into your body, eating iron-rich meals, and getting tested if needed. If you feel low energy, low motivation, or low focus, don't just push through it. Iron might be the key you have been missing. Stay strong, stay curious, and remember, your health is your power.
Please don't forget to like, comment, share, and subscribe.